Our healthcare sector has been undergoing a lot of reform. And I think you know this. And one of the things that constantly we have been asked is whether we are alive to the problems of the participants, those in the sector, and whether what we are doing as government truly solves those problems. We placed healthcare as an economic transformation agenda to answer two questions. One, that healthcare shouldn't be the reason people die early or get poor while seeking care. And that has been part and parcel of lack of economic growth when people who have small hardwares, working capital of 100,000 or 200 or even 50K, but they make some living out of it. You know, they sell something, and at the end of the day, they have 1,000 or 2,000 shillings, some income that enables them to fend for their families, to pay school fee, even to pay government tax. And then an illness comes, and all of that stock is gone. Just one illness, maybe not even a serious one, just an illness. You get admitted and you have to close your hardware or your shop. And then we are back in this cycle of a family that cannot move ahead. And that's the story of nearly 70% of Kenyans. People stuck because of healthcare. And so we thought to ourselves that this health financing issue has to be tackled. And even though today we are discussing technology, I always take the opportunity to remind us that even with the smartest of technology, our work and the greatest piece of work we can do to transform healthcare is still in healthcare financing. Giving everyone access to a mechanism that ensures they can afford and access healthcare without worrying whether their shop will collapse. And that's where the social health insurance is important. And we continue to preach this gospel, working with everyone, because I know that I'm speaking to a company that has existed on data for very many years. I'm sure you have a lot of reach to continue helping us preach this gospel. Because if we don't widen our net of resource to finance healthcare, everything, including all the innovations that we have, they all fall flat. And the second thing that we have always wanted is how can we place healthcare on the path of economic growth? How can healthcare bring in investments, innovations that create jobs, that bring in foreign direct investments, that stabilize our manufacturing, and perhaps that places Kenya at the top of the world when it comes to innovative companies. And Kenya's been ahead when it comes to technology. How can we make healthcare be that space that makes Kenya be counted in the future, just like maybe financial services, Safaricom did? And I believe that second question can be best answered by this kind of summit. And within those two questions, we have crafted all a model for universal health coverage that is very focused on answering the intersection between illness and poverty, but also the intersection between illness and innovation. Newer ways of doing things, not just technology, but the entire ecosystem of new solutions, new methods of governance. Sometimes that intersection is not very comfortable. It's like illness itself. It's characterized by anguish. It's characterized by anxiety. Often a lot of noise. But eventually, we have to move ahead. And even though technology is not the answer in itself, technology is the infrastructure that facilitates that answer. Today, I know we're talking about the promise of technology in healthcare. And technology in itself is rapidly evolving. And I'm glad the chairman has talked about one of the principles or the pillars of this company is dynamism. Because what we discuss today may be very irrelevant tomorrow when it comes to technology. Unfortunately. But it can be a foundation even when it becomes not as relevant, it can be a foundation of what we do tomorrow. And so that dynamism and the spirit of change has underpinned technology. The way phones used to look like 30 years ago and 20 years ago, and what was in them is very different. And technology in itself teaches us that we must change. And so you're the best example of why our healthcare system must also change, why it must transform. And I want to make the case that we cannot speak about technology, but want the status quo of yesteryears in terms of how we make our decisions, how we finance, how we position health workforce, how we digitize. Everything must change because technology itself has shown us that we don't change, we perish. We become Kodak and Nokia. And I loved coming here because it gives me the moral authority to speak about our transformation. Gives me the moral authority to speak about transformation and why we must do it. Why we must move from NHIF to SHA. Why we must get everyone to pay up their contributions. Why we must do the things we want our hospitals to do. In the anguish, in the anxiety, in the difficulty, why we must do it. Because otherwise we perish. And when we perish, unfortunately, we fail not just ourselves, we fail the patient. And while many of us are speaking about this triad of the health financier, the insurance, the person who provides the care, and the patient, the government is predominantly focused on just the patient. Not because everyone in between is not important, but because that's the constitutional imperative. The people. Article 1 of the Constitution, the people. And so for me, when I'm here, is to look at the foundation that you have built, the foundation that we are building, and how that must usher us into a future, and the change in between, the change within our healthcare systems, and the change that you must embrace for us to go in that journey together. We have enacted a Digital Health Act. We have passed regulations. We have a Data Protection Act. We have a constitution that is very strong on information access, on data issues, on rights. And then we have all of these ideas. I think Kenyans have some of the best brains, the best solutions. So between this governance imperative and the innovations that we have, how do we shape the change of the future, change for the future? And that brings me to how we can work on a shared frontier, how we can form some strategic assets together, not by incidents, not by force, but by forming a pathway of progress. As I mentioned, we have key assets. For 60 years, we have NHIF data that has not been very useful to this country. A lot of data, 60 years of information, all the things that we've paid for, the people, the diseases, all of that. And then now, we have even expanded and invested in a health information exchange, a digital infrastructure or a pipeline that draws from above all the registries that we have for the health workers, for the hospitals, for the community health systems, from the drugs, all the registries at the top, and then brings in all the actions from the bottom, from the hospitals, from all of our NGOs, very soon from yourselves. So how do we move? How do we use this asset of data to move forward? And I know you too are asking yourselves that question. How do we make this a key wealth for the country? Not just wealth in terms of data usage, but wealth in terms of innovation, so that Kenya can be counted among the countries of the future who laid the foundation for data-driven health systems, but didn't stop there. Produced new ways of delivering care. Because the truth is that we have problems within our system. Patients are still complaining. We have progressed, we have improved, we have solved a lot, but we are not there. We are not there. And first and foremost, the patient, as I mentioned. That's, for us, from a government perspective, very important. How do we solve those things, those waiting problems, those issues around visibility, the access to financing? How do we use data? How do we innovate around it for that? Number two, how do we use this data as an investment for innovation? How do we create a marketplace that can harness all of these ideas that the youth have to keep them engaged, to create a health technology ecosystem that thrives, but more importantly, to solve the diagnostic problems. Right now, there's a lot of changes in rapid diagnostics technology. We want to move to manufacturing, but as we want to move to manufacturing, we have to do something called technology transfer. How do we innovate around research? Because the way that I used to do research, and Dr. Gakombe is here, and perhaps being my senior, he knows. We went with some papers, collecting data, doing all of these surveys. I think that is outdated. In this era of data visibility, I think all those surveys that we used to do are outdated. I think the way in which scientists right now for example, looking at retrospective studies, I think all of that is outdated. Yet it is those studies that lead to new drug innovations, rapid diagnostic tests, new technologies around X-rays, around PET scans. How do we create that innovation marketplace using the data that we have? And the last piece is, how do we use it to change the story for investment? How do we use it to de-risk the investments in infrastructure?